So today we're going to talk about why it is so difficult to access our own medical records.
So Dr. Tara Kiran is a family physician at St. Michael's Hospital and the founder of the Our Care Research Initiative on Canada's primary care system. And she's here with us today. Welcome back to the show, Dr. Kiran.
Thanks for having me.
So I think I can speak for everyone when I say it shouldn't be as difficult as it is to access our own medical records. You'd think it would have gotten easier also with digital technology, but it hasn't. Why is it still such a headache?
Yeah, so I think the first thing I'd say is it's not a technology problem. You know, we've got the technology here in Canada. We know there are many other countries where people have access to their records. The technology exists. So I think it's more one of political will. And I would also say there's like a historical context here. So the way that our health systems have developed, the information systems, there are different data systems and they don't actually talk to each other. And then different providers or players kind of own those data systems and they don't really have an incentive to have the records shared with each other or with patients. And we really need to change that.
Let's talk laws for a second, because it actually feels like it should be illegal, the fact that we cannot access our records. So as Canadians, are we legally entitled to access our medical records?
Great question. So there was actually like a legal ruling several years ago that says that patients do have the right to examine and copy their records. So you own the information in the records, but you don't necessarily own the records. I know that seems like a fine distinction, but that's the challenge, is that there isn't actually like a law that says patients can access the records easily. And that kind of law does exist in other places. So we know in the US and in Europe, they do have that kind of law that has compelled companies or providers to make sure that they can share it with patients. And that's what we need here in Canada. We need legislation, I think, that compels companies and providers to share information with patients so that it is accessible to them.
Yeah, this mess with accessing our medical records, it's hard on both patients and healthcare professionals. So what are some practical ways that even small changes could make a difference?
Yeah, so if one of my patients had access to their own records, it would actually help me as a doctor because, sometimes they go to see a specialist, they might go to the emergency room, they might go be admitted to hospital, and I may not get those records actually, but if they had access to those records, they could share it with me. I could see what medication changes there have been, what new diagnostic tests they've had, what their lab tests showed. It would mean I wouldn't have to chase those down. It would mean I wouldn't reorder things. And ultimately, there's also a patient safety aspect. There was actually a really important case back in Alberta. A young man named Greg Price, he was actually diagnosed and eventually died of testicular cancer that could have been prevented if he'd actually had access to the test result earlier. And part of what happened was he didn't have access to his records, right? So if he had access to that records, the whole story and trajectory of his life might have changed. Wow. So that's how powerful this can be. And so, his sister, his family, they're big advocates for this, Greg's Wings Foundation. But that's a big example of how we need to do better in Canada.
Yeah, for sure. Listen, you've done a lot of work examining what other countries are doing, what works, what doesn't work. So let's talk about what have you seen around the world that does work in this department?
Yeah, one of the countries I think that has the best information systems is Denmark. So when I went there, I was really struck at the app that they have for their patients. So it's a really easy to use, customer-friendly app. On it, you can easily see your medications, your immunizations, your lab tests, your doctor's appointments. You can find a family doctor on the app, like all sorts of things. One really small thing that is actually a big thing, like they have what's called an integrated medication module. So this means that the patient, the family doctor, the specialist, and the pharmacist all see the same medications. And if the specialist or family doctor update the medications, change it, it's actually updated in real time for everyone.
What a concept.
I know.
It seems so simple.
So simple.
But this is so important.
Game-changing, right?
Yes.
Yeah.
I'm struck by that just because we've just gone through this mess with my father-in-law when he moved to different locations and nobody was communicating. It can be such a headache for so many people and so emotionally taxing. But does Canada, I think people ask the question, we've heard about Denmark in reference to better medical practices all around. Does Canada have the funds and the resources to be like Denmark?
Yeah, good question. Well, I have gone to other countries. So one of the other countries that I've visited is Spain. And I visited a province called Catalonia. And there, they've had an app for their patients to access their own record since, get this, 2009.
Wow.
Yeah.
Okay.
So, it's not just Denmark. We are a laggard.
So are there steps being made that might be taking us in the right direction? Like, what is the state of the union right now, so to speak, in terms of us being able to access our
Yeah, so I am hopeful. I mean, there was just recently new legislation introduced into the Senate, Bill B5, that's supposed to really compel providers to share their data between each other. But it doesn't go far enough to say, in my opinion, it doesn't go far enough to say that patients have right to access their own records. However, having said that, I will say there are many provinces and territories across the country where actually they have recognized this is important. And there are now website portals, there are apps that they've developed where patients can go on and not necessarily access all their data, but access some portions of it. So like say maybe see your lab tests or your diagnostics. Actually, in a recent interview on my podcast, Primary Focus, I interviewed someone very senior in the Nova Scotia Health Authority, and they talked about how in Nova Scotia, the last couple of years, they've developed the Your Health NS app. And so that's just one example of this kind of thing. So they have an app in Nova Scotia, and a lot of people actually don't know about it, but it's there, and you can see your medications, your lab results, your diagnostic tests, your hospital visits.
Wow.
Yeah.
Nova Scotia.
Yeah.
Listen up. This is for you. That's amazing.
Yeah.
So as we wait for our system to become more efficient across the country, do you have any advice for Canadians who are facing roadblocks when it comes to accessing their medical records?
So I think it's good to go back to this concept that you have a right to see your medical records, right? And it's true that providers may charge you for that. And so you've got to be prepared for that. And if you can't afford it, just say you can't afford it, because many organizations, many providers would actually make an exception if they know that you can't afford it. So you have that right. Make sure you remember that. And then, as I mentioned, all of these there are many provinces, the Western provinces, Atlantic provinces, Quebec, where you might be able to access some portion of it online. So just Google health records in your province, and it should come up. I think Health 811 is also a really great resource in general. I will say, I think what we really need is like some kind of heated rivalry between provinces to try and get us to that level where all of them are providing us with that kind of data.
Nice reference.
Yeah, very
Nice
good.
reference. Dr. Kiran, this has been eye-opening. Thank you so much. Thank you. Thank you.